Hi, hello, welcome to our new video. This video will talk about post-basic BSc nursing maternal nursing questions. I hope our videos will help you to prepare the exam well and approach it with confidence. Let's get started. As like our previous examination, maternal nursing questions papers include long essays, short essays and short answer questions. So we can start with the long essays. The first question, define atonic postpartum hemorrhage. The sub questions are, list the causes of atonic postpartum hemorrhage. Next, explain the role of a nurse in the management of atonic PPH. Then the next question is, define preeclampsia. Sub questions are, enumerate the clinical features and complications of preeclampsia. Another sub question is, describe the management of preeclampsia. So the third long essay question is, define hysterectomy. Sub questions are, list the types and indications of hysterectomy and explain the preoperative preparations for hysterectomy. Another essay questions may be like this, define partograph and explain how you will use partograph effectively during the intranatal period. Next question, define ectopic pregnancy. The sub questions are, enumerate the types of ectopic pregnancy. And another sub question is, plan the post-operative nursing care of a woman with ectopic pregnancy and the nursing process. Another question is, define abortion. Sub questions are, describe the causes and types of abortion. Next, explain the management of a woman with threatened abortions. Another question is, define puerperal infection. Sub questions are, list down the puerperal infection and explain the management of a mother with engorged breast. Next is, what is infertility and write the causes and diagnosis of infertility. Next sub question, explain the medical and nursing management of a couple with infertility. Another questions, define preterm labor and what are the characteristic features of a preterm labor. Describe the management of preterm labor to continue the pregnancy to term. Next long essay questions, maybe that is like this, explain minor disorders of pregnancy. So it will get in short answers too. Then the sub questions, discuss the role of a midwife in educating pregnant women about antenatal care and diet. Another question, enumerate the signs and symptoms of pregnancy and discuss the diagnosis of pregnancy. Next long essay question is, what is the complications of breech delivery and describe the management of breech presentation. Another question, what are the causes of asphyxia neonatum and describe the clinical features and management. Okay, this is the most commonly asking question, define normal labor and explain the mechanism of normal labor and the nursing management during second stage of labor. Another question, list the aims of antenatal care and explain in detail about antenatal care. Another one, discuss the diagnosis and the management of cardiac disease during pregnancy. Next question, define forceps application. Sub questions are, explain the indications, procedure, maternal and fetal effects of forceps applications. And one more sub question, describe the nursing care of a mother undergone forceps delivery. Another question, define rupture of uterus and explain the etiology and pathophysiology of and diagnosis of uterine rupture. Another question is, define placenta previa and list out the clinical features and describe the management of placenta previa. Define uterovaginal fistula and discuss the causes and the types of UVF. Explain the management of UVF. Next is, what are the causes of asphyxia neonatorum and describe its clinical features and management. Another essay question is, define maternal mortality rate and sub questions are, list the causes of MMB and explain the role of a nurses in prevention of MMP. Another question is, define neonatal jaundice and discuss the diagnosis and management of neonatal jaundice. List the indications of cesarean section and explain the post-operative management of an emergency cesarean section till discharge. Again, lot of long essays are there. And the one, define fibroid uterus and enumerate the causes of fibroid uterus. Sub question is explain the medical surgical management of fibroid uterus. Another question, what do you mean by fetal distress? And explain its etiology, pathophysiology and management of fetal distress. Next, define induction of labor and explain the management of labor during induction with the application of nursing process. Another one, explain in detail about growth and development of fetus. So, these are the long essay questions most frequently asked. So, we can discuss about the short essay question. First one is eclampsia, invasion of uterus, effect of anemia in childbearing, post-mature baby, onset of labor, signs of previous childbirth, fertilization, mid-trimester termination, universal precaution, intrauterine growth retardation, planned parenthood, fetal skull. It is an important question you may get in your practical exam also. Another question, investigation during pregnancy. Another one, changes in cardiovascular system in pregnancy. Amniotic fluid. Explain the condition of asphyxia neonatorum. Enumerate the diameters of gynecoid pelvis. So this question you will get in your practical exam also. Another one, discuss the birth injuries of a neonate or newborn baby. Another one, enumerate the causes and management of cord prolapse. Next, explain the management of modalities of MTP. Another one, immediate assessment of newborn. Another, management of abruptio placenta. Next, discuss the diet plan of antenatal mother at the 3rd trimester. List the complication of cesarean section. Another one, physiology of lactation. Growth of a pregnant uterus, cord presentation, resuscitation of a newborn. Another one, postnatal care, pelvic inflammatory disease, medical termination of pregnancy. Next is contraceptive method. Another question, explain the steps of a baby-friendly hospital initiative, physiology of menstrual cycle, explain the management of molar pregnancy, explain the methods of placental expulsion, write briefly the care of premature neonate. Another short essay question is describe an episiotomy, care of neonate in NICU with respiratory distress syndrome, and describe the diagnostic measures that are carried out in the case of infertility. Explain the congenital malformation of newborn, properties and compounds of breast milk. Another one, shoulder dystocia and fetal circulation. These are the questions maybe you will get in your examinations in section of short essays. So we can discuss about short answer questions. So don't forget to work on it. The first question, list the longitudinal diameters of fetal skull. Another, define neonatal jaundice. Next, mention 2 indications for induction of labor. Then define hyperbilirubinemia. Next is what are the signs of crowning and define secondary infertility. Next, define uterine inertia and define lightening. Write any 2 difference between true labor pain and false labor pain. Write 2 difference between precipitated labor and prolonged labor. Another one, list 4 causes of bleeding during pregnancy. What is acute inversion? List 4 obstetrical emergencies. List the objectives of safe motherhood. Weight gain during pregnancy. Oxytocin. Apgar score. Construction ring. Anterior posterior diameters of fetal skull. Obstructed labor. Fundal grip. Next questions are etiology of infertility, meconium, birth asphyxia, atonic uterus, favorable cervix, prolonged labor, postpartum hemorrhage, newborn reflexes, uterine deformities. So far, I am discussed about the long essay, short essay and short answers. Make sure that you are worked on it before reaching the exam hall. All the very best. Please subscribe our channel, click the bell notification so you will notify every time when we post a new video. And be sure to leave a comment. Thank you for watching.